Hello everyone. So in last video we are discussing about the autonomic introduction to autonomic nervous system, where we discuss about the basics of parasympathetic nervous system. So let us discuss some MCQ regarding the last video. So first question is, cholinergic system does not contain which of the cranial nerve? As I told you by means of a cartoon that all the 12 cranial nerve, from where I told you that the 3, 7, 9 and 10 is associated with your cholinergic system. Third one is your oculomotor. Seventh one is your facial. Ninth one is your glossopharyngeal. 10th one is your vagus. Okay, so here the does not question has asked your does not, your optic will be your doesn't comes under your cholinergic system, that is it is optic with second cranial nerve system. Okay, so which enzyme is the rate limiting enzyme in the acetylcholine synthesis? As I told you, is that one of the important enzyme that act for the synthesis of acetylcholine by combining acetyl coenzyme with choline by action of this enzyme choline acetyl transferase, and this enzyme is act as the rate limiting enzyme for the acetylcholine synthesis. So next question is, methacholine show maximum agonistic action on which receptor? As I told you in the classification table, that you will remember that we have three major receptor, muscarinic receptor M1 and M2 M3. So उसके याद रखने के लिए मैंने आपको बताया था, पहले खाओ फिर दिल लगाओ, देन बाकी काम बाद में. So M1 is खाओ, M2 is dil lagao, dil is heart. So as I told you, M for methacholine, M for myocardium. So myocardium is your heart, that is M2 has so maximum activity in the methacholine, so maximum activity in your M2 receptor. So next question is, negative chronotropic effect is associated in coupled G protein coupled receptor. G protein coupled, the M2 receptor is associated with your is a autoreceptor. So autoreceptor means, as I told, that so inhibitory activity, that is it inhibit activity. So inhibitor activity is shown by opening of the potassium ion channel, that is it is of GI type. In GQ and GS, the it causes opening of the calcium channel. Okay, next question is, this is about clinical trials, is which phase of clinical trial is considered as the first patient study? Whenever question asked about first patient study, is associated with first time, in which phase the first time patients are involved. You know that in the phase 1, first human study, first human volunteers are included, except in case of anti-cancer drug. But in case of phase 2 and phase 1 is associated with a determination of safety, that is maximum tolerated dose. Phase 2 is about efficacy. So in the phase 2, we are basically take the patients, we are consider patients for the phase 2 clinical trial. Next one is, Stevenson-Johnson syndrome is an example of which type of hypersensitivity reaction? Stevenson-Johnson syndrome is a which type of example of type of adverse reaction, that is it is a type 3 Arthur's type. Which immunoglobulin cross placenta? That is IgG. IgG is a immunoglobulin which can crosses the placenta. Rapid development of tolerance is called as tachyphylaxis. Tachyphylaxis means rapid development of tolerance. Idiosyncrasy is a type of hypersensitivity reaction. Tolerance and intolerance is associated with decrease the response of the drug to for a particular disease. Next question is, which of the following drug does not causes hemolysis in the patient of G6PD deficiency? As I told you that G6PD, glucose 6 phosphate dehydrogenase, is a enzyme associated with pentose phosphate pathway. So this is G6PD enzyme basically regulate the metabolism of NADPH. Okay, so all these three drugs will causes if the G6PD deficiency type of drug, if such type of drug is given, it causes hemolysis. Other drug like primaquine, okay, quinidine, sulfonamides. This class of drug also causes hemolysis. Which of the following is a compositions of supraadditive reaction? So supraadditive effect is when two drug is combined, their action get double as comparison to the individual one. So here answer will be your levodopa and benzerazide. Okay, levodopa and benzerazide will show additional supraadditive effect. So which of the following is not a ligand gated tyrosine kinase, receptor tyrosine kinase, which is following is not. So to remember this, you can remember a simple mnemonics, that is PIG. P for prolactin, I for insulin, G for growth factors. So these are comes under your ligand gated ion channels. Okay, sorry, your receptor tyrosine kinase channel. Here your acetylcholine will not come under this, which is not a ion channel receptor, that is 5-HT1. So you should remember that all the serotonin receptors are G protein receptor except 5-HT3. So 5-HT3 is not come under uh, uh, G protein coupled receptor. 5-HT3 is a ion channel receptor. So that's all for today. Thank you.